So my name's Kejia, VP of Product Design at Astrana Health. I want to share with you an overview of how we're using Awell to transform our care management practice. A bit of background, we are a value-based care enablement and delivery company. That means we help independent physicians associations take on risk and value-based contracts, as well as operating our own primary care and IPA networks. That allows us to manage over 1 million members across the country through a network of 12,000 providers in 32 different markets. And it's really broad population. Our lines of business covers everything: Medicare, Medicaid, commercial exchange. And as you can imagine, with such a diverse population, you have a whole broad range of clinical programs targeting our riskiest patients, stretching from disease-specific programs, such as COPD, through to programs targeting SNP, cards care management, as well as specific risk and quality programs that I'm sure you guys are all familiar with. This slide is really, I hope it's not too triggering, but this is the reality of care management in this country. We have tons of hard-working managers, nurses, coordinators, trying their best to deliver the care that's necessary for our neediest population. The reality is they're just wrestling each day, managing their work through these custom-built spreadsheets. Some of them super elegant and actually like very complex and sophisticated. But over time, this grows into like a sprawling network that ultimately takes away from these folks working at the top of their lives to deliver their care. I just want to be clear. I love spreadsheets. Spreadsheets are super flexible, easy to change, and support many people using it. The downside is they're super flexible, easy to change, and support many people using it. And this was our reality, and we ran into all the bottlenecks that all of you guys have. So not just having to manage all of these sorts of spreadsheets, but really this ends up siloing a lot of information and work, making the necessary cross collaboration very hard. And even with really sophisticated VLOOKUPs and different scripts, it's maybe limited with transformations. And not least, once we built this kind of Goldberg machine, change into it, really just like incrementally adding to this. And this is one of the reasons why the leadership of Astrana chose to build our own these budgets. Then a functionality there's price delivering care workflows, teams on the pipeline. We found though, as we were building this, is there was a really key missing piece. It was what Thomas and I described as like the orchestration layer, the layer that sits between our data platform that takes the insights, targeting, and attributes of our members, and then translates this into triggers for triage patients, as well as implement with key skill care workflows for these populations, as well as automations be then delivered into at the point of care for our teams. What this means in practice is, and this is just a snapshot of what we'll do, in Awell Studio, we can now build various workflow questions and triggers, and publish that directly into pathways. So what you're seeing on the left is a snapshot of Awell Studio, and on the right is pathways where for this specific task, we've configured it to assess the member. And so where this task is showing the appropriate workflow context for to be successful with this patient in this moment. And if you guys are familiar with the flexibility of Awell Studio, you can imagine all that we're able to build and which way it's on. But we've been successful with the teams directly going in and doing modification, allowing a much faster creation cycles, as well as being able to navigate all automations like found on the path. You will. We've been able to say quite a bit about it. Like one of the first programs that we discharge for this remat program that we were running spreadsheets and pretty quick they were raped more with sets. Yeah. But our teams are able to use that time to give you more value add work for the patients rather than some more of the manual orchestration they were wrestling with. And what we've seen here is we've been able to really accelerate a lot of our work. This is work that we wouldn't been able to do with our homegrown system on its own. One of the key things is support of the political teams and our stakeholders work super closely in the Awell Studio itself and rapidly shift that work to pathways. One of the models that was really attractive about Awell is they're very keen to do this forward deploy model where they're able to folks with their team or work directly with us. It's like 1 to 2 day hackathons where we can lock a lot of new features or onboard new teams complete, rather than a typical vendor where you'd have a big on requirements gathering session and then, weeks and months would go by and then you finally get something. This gave us a much faster partnership for us to work together. And the other key thing is just all of the automations that come out of the blocks, whether that's simple router logic through to sending SMSs, and Sue will be playing around with their API integrations that's going to bring our provider network into the mix as well. This how we learn without is challenges. I think one of the first things that we put up against is just how to marry the conceptual model with being a well partners. So this is a simple sketch that Thomas put together to try and help us marry the different concepts between the systems. Airflows in AOL map for program and pathways, tracks in AOL mapping to tasks, really enshrining this. This was super critical because AOL doesn't necessarily describe how should sit and how abstractions should map to your systems. That's something that's a real strength that allows it to work with a lot of systems, but requires that deliberate work up front, marrying these two to really be able to move in a coherent way so that you're making choices and evolving your system alongside what AOL is. The thing to call out is whenever you work with an external vendor and are using them to unlock capabilities, there's a balance of best right kind of that integration between your vendor and your product versus your engineers building net new features that your customers want to really help all these platform officers. This is one fairly ones where OS came to our offices and spent 2 days getting us up to speed in building really just understand the full end to end. Found these kind of short and sharp sessions to really help unlock new integration capability in a way that I think more traditional vendor partnership would take much, much longer. Probably that prevents them from building the momentum necessary to use it more widely. So in terms of what's coming up, as I said, lots of new automations that we want to run. We want to take as much admin work and the work of shuffling data around or routing and finding appropriate people. We want to take that logic inside as well, so that our freer new top license flow. I talked about new integrations, the AHR that we will be able to score in the coming months. Really, they want to kill more spreadsheets. I do love spreadsheets, but when we're trying to scale the population and the people that we're reaching and launching new programs, we really must move into a system where the workflows are codified and we have the flexibility to be able to adapt and evolve those with the capable teams while also having this bird's eye ability to coordinate. That's all I have for today.